Let's talk about a dark chapter in American history, the Tuskegee Syphilis Study. This was a research project that lasted from 1932 to 1972, where the United States Public Health Service, along with the CDC, studied the progression of untreated syphilis in nearly 400 African American men. The true purpose of the study was hidden from these men, who were led to believe they were receiving treatment for bad blood, a catch-all term used at the time in the African American community for various ailments. Imagine being promised free healthcare, which was a significant offer for the poor black sharecroppers participating, only to be misled and have the cruel reality hidden from you. Not only were they never told they had syphilis, but they weren't treated for it even after penicillin became available in 1947 as an effective cure. The men were under the impression the study would last 6 months. It stretched to an unthinkable 40 years. Over time, it claimed the lives of participants, their loved ones, and even led to children being born with congenital syphilis. The shattering ethical violations only came to light in 1972, when a whistleblower stepped forward, causing an uproar that led to new regulations for protecting human subjects in medical studies. President Bill Clinton's formal apology on May 16, 1997, admitted the government's shameful conduct and sought to make amends, albeit the physical and emotional scars were permanent. Yet, before Tuskegee, the Oslo study in 1928 had already outlined the natural course of untreated syphilis, but did so by retrospectively studying white males who had, by chance, not received treatment. The Tuskegee researchers, wrongly assuming that racial differences would affect syphilis's progression, continued their study, despite evidence and ethical considerations. Even when life-saving treatment became widely used, they denied the men the care they needed, under the guise of scientific inquiry. As a result, significant distrust in medical science and the government persists within African American communities. What's equally alarming is that even though the study's intentions were exposed, it led to a decline in life expectancy for black men of about 1.4 years due to increased medical distrust. This sad episode touches on the role of the Tuskegee Institute and its staff, who, it's uncertain to what extent, were aware of the study's lack of ethical grounding. The eventual outcome of the study saw the creation of the National Center for Bioethics in Research and Healthcare, and the realization of the need for better protection of participants in clinical research. Finally, the unfortunate legacy of the Tuskegee Syphilis Study serves as a stark reminder of past wrongdoings and the importance of ethical integrity in research that holds individuals' rights and well-being above all. It's a chapter of history we must not forget to ensure such injustices are never repeated.